in the intense world of medical emergencies.
One patient, 3 times stab wounds.
There's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, highly specialist teams are ready to react to these major traumas.
PTO 4 minutes.
By road
It's a shooting of a male currently being shot ahead.
and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
This is going to be tight and painful, okay, but it's going to save your life.
day and night.
All right, well done.
From car crashes to stabbings.
He's been hit and stabbed in the head.
Here, where time is critical, lives will be saved.
Everyone clear? Yep.
These emergency doctors and specialist paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
I suspect we are going to be cracking open the blood products en route.
Female casualty.
Filmed alongside the critical care teams, we captured every vital second as these specialist crews work to save lives.
1, 2, 3, roll.
Tonight,
Was he well saturated on air?
a man's impaled on a sheet of glass.
So what I'm going to do is put a little bit of gauze into the wound, so it's going to be a little bit sore for a second, sir, okay?
A young woman's run over by a car.
Sorry, honey.
We're going to the Femur here, but there's a lot of pain.
We're going to give you some strong painkillers and pull your legs straight.
There's a stabbing in a city centre.
How many wounds you got? Quite significant abdomen.
Yep.
Right flank.
Okay, ready, steady, roll. That's perfect.
And a man collapses on a canal boat.
How's that pain? Any better, any worse? A little worse, okay.
It's dawn, and at an ambulance base in the Black Country, Ryan Ferris and Grant Soulsby are starting their shift.
Are you happy with the ketamine pouch just in the drugs pouch?
Yeah.
Both are highly trained critical care paramedics. For the next 12 hours, they'll be responding to all manner of medical emergencies across the West Midlands.
If we were going to try and predict it for today, I would say that weather-specific stuff, maybe a couple of cars that might slip off the road. We might get someone with a nasty fracture.
We'll see. I've stopped trying to predict how these days will go because you just can't get it right.
Ambulance service, is the patient breathing?
Can I have one straight away, please?
Is he breathing?
Yeah, he's breathing.
Is he conscious and awake?
Yeah, he's conscious and awake.
Okay, let me know what's happened.
We work in a glass factory. He's just broke a load of glass. He's got a massive gash on his back, bleeding heavily.
Okay, so use a dry dressing or a clean cloth, fold it into a pad, okay?
Yeah.
And just get someone to press firmly and directly on the wound. I've arranged some help for you, okay?
A 999 call has reported a serious accident at a place of work. Grant and Ryan are immediately dispatched.
So we're going to reports of a male who has apparently fallen through a glass roof. There's some notes on the case to say the patient may have suffered a penetrating injury to his back. If he has a penetrating wound, it's quite a lot of important sort of vessels and organs in there which we can damage. So in sort of the extreme cases, these patients can be very unwell cohort of individuals. They need stabilising, they need temporising measures, but ultimately what they need is a surgeon.
While Ryan and Grant head to the scene, the trauma desk managed to find out more about the man's injuries.
9-5.
Right, sorry, thank you. Just let you know, I've spoken to the patient. He's speaking in sentences. He's got a radial pulse according to the colleague who's with him. They're saying it is penetrating trauma, so I just thought I'd pass that on to you.
9-5, that's all received, and we'll be in attendance in the next 60 seconds or so. I say, just leave her by, go and have a nosy.
When Ryan and Grant arrive, a team of paramedics are already treating the patient.
Morning.
46-year-old Colin had been using a cutting machine when it became unstable. pushing him backwards into the edge of an upright sheet of glass.
They've just got penetrating trauma here to the chest, as you can see. He hasn't got any shortness of breath or anything like that. He's about 7 or 8 inches long, deep. Just a favour, I'll pop this off for a second. It's in a good one. You can see his ribs there.
Yeah.
Take a picture of that.
The wound is so deep, Colin's ribcage is clearly visible, raising the possibility of a punctured lung.
Was he well saturated on air?
Yeah, his oxygen has been 99. We just put the oxygen mask as a trauma, really. Blood pressure's been stable. He's not tachycardic.
Unfortunately, it's happened, but I think you're doing quite well considering, sir.
Although Colin's not currently displaying any symptoms of organ damage, only a hospital scan will tell for sure.
How is your pain at the moment? 6. Okay.
First, Ryan and Grant must get the wound dressed.
It's just quite large, isn't it? So I'd probably just get a chest seal to hold it on. It should fit us quite nicely. Perfect, thank you.
A chest seal is usually applied to wounds that have pierced the lungs, but in this case, it's suitable for covering the large surface area of the cut.
So what your finger did? Otherwise, I'll do what I normally do to myself and stick myself to it. I think Kirsty said you've already given him some TXA.
Yeah, he's just had a grab.
Yeah.
TXA, tranexamic acid, has also been administered as a drug that promotes clotting.
So I think as these guys have said, then it'll just be a trip off to Queen Elizabeth Hospital, okay? Because you're going to need some scans on that.
Yes.
Make sure there's no underlying injury.
Okay.
Ambulance service. Is the patient breathing?
Yeah, she's walking the side of the road. I was driving past her. She's running across the road.
Okay,
she's running across the road. I'm faking. Hello?
So is she lying in the road?
Yeah, she's lying on the side of the road.
And is she fully awake?
Yeah, she's not awake. She's conscious right now.
Is she gasping for a breath?
Yeah, she's in pain. She got blood on her head.
Right, okay. And is it just the head where she's got an injury?
Yeah. It's just the head that hurts, so your back legs, everything. She can't move her legs.
She can't move her legs?
She goes, no.
Right, okay, so you need to keep an eye out for the ambulance. We are coming as the emergency. If she becomes unconscious, then you need to call us straight back to let us know, okay? But we're not going to be long.
All right.
Are they receiving?
Go ahead, mate.
Just to let you know, we've gone mobile.
Just a few minutes into their shift, critical care paramedic Alistair McNeil and Dr. Ali Hussain receive a call out.
So the details are a bit unclear, but it sounds like as if there's been some sort of car accident. And they're receiving.
It is a 18-year-old female pedestrian versus car. Patient has a head injury with a GCS of around 14 and closed left femur, significant bullseye to the windscreen.
A bullseye is the characteristic smash left on a car windscreen following a head impact.
Yeah, that's all received, mate. Turns out it's an 18-year-old girl who's been hit by a car and has got a head injury, but she's also broken a thigh bone, which is a very strong bone. Then says head injury, thigh bone, God knows what else is going to be injured in between. Then there's a lot of softer, more fragile stuff between the head and the leg. So for all intents and purposes, at this stage, it could very much be a life-threatening injury until proven otherwise.
The accident has occurred on a quiet residential road.
Thank you. Hey mate, you alright? Not too bad. What have you got?
Ali and Alistair are briefed by an operational manager.
Got an 18-year-old female, it's been hit by a car, significant impact to the car.
Oh yeah. She just stepped out by the looks of it all. The car's not moved since.
The driver said she was on the grass and then stepped out.
Fair enough.
The patient, Beth, is already in an ambulance. Damage to the car shows the force with which her legs struck the bonnet and her head the windscreen.
Hello. Hey guys, you alright?
Hello.
It's Ali and Alistair.
How you doing?
Thank you.
You guys ready?
Yes, please.
So we've got Beth, and got sustained one head injury to the right, more or less temporary here.
Yeah.
Now bogging it now, looking for concerns in that area, but she has got retrograde on the knees and that's all that's the quite yet.
Beth, Do you understand what's going on right now?
Yeah.
Yeah.
Did you just get run over?
Yeah, unfortunately. Do you remember?
No. Can't remember what's happened.
Yeah.
Beth has no recollection of the accident and may be concussed.
Working my way down, chest is clear, abdomen clear, but we get to the femur here, but there's a lot of pain.
Beth's thigh bone is also clearly broken.
She's saying she can't feel the leg, but when I'm testing sensation and stuff, there's full sensation down there.
Perfect.
It's a serious injury which needs to be treated swiftly, as it can lead to dangerous internal bleeding or blood clots.
Any chance you could be pregnant at all?
No.
Good. If you take a big breath for us, really, really big. Any pain in the chest?
Just my leg.
Nothing in your tummy?
No.
That's fine. Beth, so you've broken your leg, and so far, thankfully, doesn't look like anything else. We're going to give you some strong painkillers and pull your leg straight.
Pulling a broken leg straight helps reduce the risk of complications, but it's a painful procedure.
It might hurt to start off with, but honey, look, because of the way the bone is right now, if we pull it straight, the muscle won't spasm and it won't hurt as much. A little bit of pain now, we'll get that sorted. Line A receiving.
Roger, Stefan.
So, 18-year-old female, she has got a closed right femur and a head injury, right temple abrasion, over. Hi guys. So yeah.
18-year-old Beth has been left disorientated by a blow to the head and has a broken thigh bone.
Sorry, honey.
Left untreated, it's a potentially dangerous injury.
It's okay, sweetheart.
And Dr. Ali is preparing to manipulate the bones back into place.
She can have more morphine, can't she, if she's only had 5, so have that.
I'll give that now.
Yeah. We're getting you some stronger painkillers, but once the leg's a bit more straight, it'll stay straight like that for a long time. It'll be more comfortable once you get to hospital as well, all right?
Dr. Ali is going to stretch the leg out using a traction device. It's a notoriously agonizing process.
We're going to get you to start to breathe on this gas and air. Do you know how to use it?
Yeah.
Like a scuba diver? Grab a hold of it with this hand, and then real deep breaths to pull it into your tummy, all right? And then we'll pull your leg straight in about a minute.
Entonox is a pain-killing gas that acts quickly, which along with the morphine will help Beth to cope with the procedure.
Okay, it's going to be sore, so you need to just nice and slow. Big deep breath, inflate it like a balloon, and out. Good. Slow and out. Excellent, doing magic. Right, I'll come to the bottom end.
Yep.
Oops, sorry.
Traction is applied with a metal splint and straps which pull on the leg.
Yeah.
It's gonna be okay. Stay still for me. Stay still.
Beth, big breaths. Right, tension coming on.
It's okay. It's okay. Keep going on that.
Stop pulling next. Okay. On now, darling.
Give me your hand, sweetheart. Give me your hand. You okay?
There we go. Right. There we go.
It's okay.
All right, darling.
Beth's femur is now realigned.
Beth, can you lift this leg up for us? Lift this leg up.
Lift this leg.
Okay, just try a little bit for me. Just need to know if there's any pain in your hip.
Dr. Ali wants Beth to raise her other leg to make sure her pelvis is intact.
That feel all right? If I push up, does that hurt?
It hurts.
It does.
Is that painful?
But Beth's struggling to communicate.
Slow it down, honey. Slow it down.
Slow
Does she
breath.
need it?
Stay down for me.
Beth, ease it up, ease it up, ease it up. Beth.
Beth.
The Entonox gas has left her confused, and now she's taking too much.
Come on.
Beth, slow it down.
Beth. Come on.
Without being aware, Beth has managed to raise her left leg.
Well, she's flexing it, isn't she?
It's a good indication her pelvis isn't damaged.
Cool.
You okay?
That's right, she's hyperventilated. Yeah.
She's all right.
But pupils are fine, neurology's fine, and you're now, what, about an hour post-injury?
Yeah.
Beth, honey, how you doing? Yeah, that's going to be the Entonox. You've taken a bit too much of the gas and air, but that's fine. That's not a bad place to be honest. Line A receiving.
Good,
Hiya, mate. So we've assessed this patient. Happy that she'll be all right to go to Russell's Hall.
Satisfied Beth has no further injuries, Dr. Ali arranges for her to go to the local trauma unit.
Heart rate 78, blood pressure 128/76, respiratory rate of 1414, saturating at 98 on air. She has received IV paracetamol, 10 milligrams of morphine, and we've just gone and applied a KTD to her right femur, over. Perfect. Hi, guys.
As her condition is no longer judged to be critical, Beth is left in the care of the ambulance crew.
You happy? Yeah. Yeah, it's all right. No problems.
Awesome. All got that ends well.
Indeed.
Male in his 30s has been stabbed approximately 5 times according to the police, and apparently it doesn't look very good.
After road traffic collisions, the most common serious trauma incidents the critical care team faces are stabbings.
5 stabs to the lower back, approximately 1 centimetre in diameter each.
In inner cities, the use of knives as a street weapon has become commonplace.
Knives are easier to carry, knives are easier to get hold of than a gun.
West Midlands Ambulance Service typically deals with more than 10 stabbings a week in Birmingham alone, and the victims are getting younger.
Heading to a 16-year-old male reported with multiple stabbings to the chest and the arm.
The minutes following a stabbing are critical.
There's 3 penetrating stab wounds here.
Even if a major organ hasn't been pierced, excessive blood loss poses a serious risk.
He could have still damaged a kidney. He could have still, tickled a major blood vessel.
A wound to an arm or a leg can often be fatal.
These are serious assaults with serious consequences.
But the critical care teams are highly trained and well equipped to deal with such emergencies.
We're going to start with a bit of this, and we're giving some tranexamic acid, which helps the blood clot.
Unlike other paramedics, they carry blood to perform transfusions.
So if they're bleeding out, if they've got massive bleeding wounds, we can give them blood. There are also some surgical procedures that we can do.
And they have other advanced techniques at their disposal.
We're able to bring the emergency department to the patient as opposed to having to wait for the patient to reach the emergency department.
Helping to give stab victims the best possible chance of survival.
Hello, the patient breathing?
Yeah.
Okay, and what's the reason for the call? What's happened?
He's been stabbed.
He's been stabbed, okay. Where's he been stabbed?
Stomach and the back.
Okay, the people who stabbed him, where are they?
They ran off.
That's not a problem. We're going to get police involved as well. So has he lost enough blood to fill a whole coffee cup from both wounds?
There's loads of blood everywhere.
Have you got anything there with you, such as a t-shirt you could use to try and put pressure on the wounds?
Like a jacket, yeah.
Yeah, okay. Listen carefully. Take that jacket, place it onto just one of the wounds, whichever one's the worst. You need to press firmly and directly onto the wound. Okay, keep it just pressed on. Stay on the line with me until the crew arrives, okay?
It's the early hours of the morning, and reports have come in of a stabbing in Birmingham city centre.
We've had a physical from police who advise that they are in attendance.
No, received, thank you.
A man's life is on the line, and critical care paramedic Kerry Hemus and Dr. Alex James are dispatched.
So we're going to reports that the person who's been stabbed multiple times in the back and after. The incident's quite recent. The priority for us will be making a quick assessment and then getting the patient off the scene to hospital relatively promptly.
4475 receiving over.
Random incident, single male, multiple stab wounds.
Kerry and Dr. Alex arrive within 10 minutes of the 999 call.
That's all received.
The incident occurred on a residential street.
Quite significant up there.
Yeah.
Right flank.
Dr. Alex is updated by a paramedic.
How many wounds you got apart from the one on the Aortic?
On the back.
One in the right arm.
Right arm.
The man has been stabbed in the stomach and several other places.
I've been checking your boxes, dude, all right? Okay, just make sure you got no wounds. Still rolling towards you, right? Check it out. Tiny puncture wound, that's nothing. No blood views there.
Okay, mate.
The team urgently need to get his bleeding under control.
A lot of blood coming out lower neck that I've not been able to.
Okay, cool.
So that's got a bit tiring.
46-year-old male. He was pushed into a sheet of glass.
In Spark Hill in Birmingham, Ryan and Grant are treating 46-year-old Colin, who has been injured in a workplace accident.
So he's got a large, kind of 6 to 8 inch full thickness laceration to the left-hand side of his upper back.
Colin has a cut so deep it could have damaged his lungs, and he needs to get to hospital as quickly as possible for a scan.
We'll probably lay him on his side to keep that open if you're happy with that. There we go. Just going to put a blanket over you because it's freezing outside, as you're aware. All right. What we may do once we get you out, just change this dressing, okay? Because you've still got a little bit of blood trickling. All right. But I love how calm you are about it all. I love it. That's how it should be.
That's calm up everyone else.
You must be a parent.
No.
No? Can we just get some...
Once on board the ambulance, Ryan wants to take another look at Colin's wound.
You can sort of lie yourself as you are like that, okay? And keep yourself in that position. So what I'm going to do is put a little bit of almost like gauze into the wound. So it's going to be a little bit sore for a second, sir, okay? But it's just to stop that bleeding from it.
The cut has started bleeding again, and Ryan needs to stem the flow.
If you bring that arm, I know it's a bit uncomfortable, just bring it up that way for a moment. Yep, perfect, just like that. Sorry, sir. We'll get you to move it down in a second, all right? It's a little bit of swell and development around there, hasn't he?
Yeah.
Annie, have you got some scissors, buddy?
We have.
We'll just cut that for me if you don't mind. I know it can tear, but it stinks, doesn't it? Thank you. Cool. So I know it's perhaps not the most comfortable position for you, but if you can lie as you are for the journey, okay?
Yeah, no worries.
Cool.
Colin is now ready to go to hospital.
Colin, myself and Grant, we're going to leave you with these gentlemen, okay? As I say, they're going to take you off to QE. Because of what you've done, we're going to let QE know that you're coming, okay? So when you do get there, there's going to be quite a few people ready to see you. That's purely so we can get you through the scanner nice and quick. And if they do find anything, then we can treat it quick, all right? So I'm going to leave you. I wish you all the very best, sir. All right. And
thanks for your help.
Have a nice day.
Cheers, thanks very much.
All the best, sir.
Yeah.
Although Colin's seriously injured, he's stable enough that Ryan and Grant's additional skills aren't needed for the short journey to the Queen Elizabeth Hospital.
As we've seen, he had quite a deep sort of penetrating wound to his upper back. It's got the potential to be quite a significant injury. Grant's already spoken to the team at QE, so we can have a trauma team ready. So fingers crossed that actually on scan there's no further damage.
Do you want me to grab a scoop, guys, or are you gonna? Yeah.
Dressed everything.
In Birmingham, Dr. Alex and Kerry are treating a man who's been stabbed in the street.
Okay, wait there just a second. We'll roll him straight onto the scoop, guys, okay? Makes sense, thank you.
The man has several wounds which have been dressed by paramedics. The deepest in his stomach is a major concern.
Are we ready to go onto back? Have you done that yet?
Yeah, we've done that.
Okay, ready, steady, roll. That's perfect.
If the knife pierced an organ or artery, there could be internal bleeding which can be fatal.
Have you got a blanket or not?
Yeah, I've got a blanket.
Radio pole, Kerry.
Yeah, fantastic. Right, let's get him covered up then. There you go, mate.
Dr. Alex and Kerry want to get him to hospital as quickly as possible.
All right, we'll sort that out.
We'll sort it out.
Apart from your back, any other pain anywhere else? All right, mate. No worries, we'll sort that out.
For now, the patient is conscious and breathing, but he could rapidly deteriorate at any moment.
One at the bottom for us.
Okay, one on each end.
1, 2, 3.
Okay, I've took the edges off there, just be careful of that hole. Okay, let's pop these back on then. Bed straps on then we'll move. Right, okay. I'll get your kit. If you want to wheel him on, I'll get the kit. Are you going to want blood or not? No.
With the nearest major trauma centre less than 10 minutes drive away, Dr. Alex's priority is to keep the man stable until he gets there.
That's it, perfect. Lock in.
Right, we're going to put a drip in, give you some painkillers and get you to hospital, all right?
I'm going to pass some details to trauma desk.
Okay.
We'll just try and get a set of obs on if we can, and that'd be amazing.
Do you stay down for it? He's fine, 126.
Have you got some TXA and I'll get that drawn up?
In addition to painkillers, the man will be given tranexamic acid to help his blood clot.
There you go. TXA, 5 mics, 5 mil. Right, let me just do this up. And then I'm going to jump off.
9-8 ambulance for the QE when ready.
As soon as the patient's hooked up to the monitoring equipment, the ambulance can set off. The man is still in a lot of pain. But as the drugs take effect, he begins to settle down.
Still breathing nicely. Yeah. Well done, mate. You're doing ever so well. I know it's really uncomfortable in that position. We'll get you off that hard board when we get to hospital, all right?
Birmingham's Queen Elizabeth Hospital is a major trauma centre. The specialists here deal with stabbing incidents every single week.
Come on. Come here now. Come on.
Here, the patient will be given a CT scan to uncover the full extent of his injuries.
OK, going into A&E now. There'll be lots of people in there that want to hear about you. OK.
By keeping their own interventions to a minimum,
OK, I'm walking into A&E now.
Dr. Alex and the team have handed him over in the shortest time possible.
With stabbing injuries, our primary concern is about control of blood loss, and there are interventions that we can undertake in the pre-hospital environment to control blood loss, but the definitive treatment of bleeding is usually in a hospital. So in this case, whilst he may well have some underlying significant injuries, there was no evidence of catastrophic hemorrhage. So the priority is to do the basics relatively well and move the patient onto hospital fairly quickly.
Ambulance services, the patient breathing?
On and off.
Okay, is he conscious and awake or is he not responding to you?
He's not responding.
Okay, is his breathing noisy?
I can barely hear him breathing.
So can you see his chest rising and falling regularly if you look, listen and feel?
I can't feel anything in the chest. I can't feel what's coming out of his mouth.
Yeah, okay, is he flat on his back? Is he on the floor or the bed?
He's on the floor.
He's on the floor, okay, so you need to roll him onto his side for me, okay? Remove any pillows or cushions from under his head. Keep checking that he's breathing until help arrives for me, okay?
Okay.
We're going to be with you as soon as we can.
A 999 call has reported that a man's collapsed in Wolverhampton. Paramedics sent to visit the patient are soon requesting assistance.
7062 on channel.
Critical care paramedic Kerry Hemus and Dr. David Balthazar are dispatched.
Go ahead.
It's a 61-year-old male who has been unwell for a couple of days, has suddenly collapsed this afternoon with some sudden abdo pain. On crew arrival, sonic of about 50, mid-50s, they're querying some kind of abdominal bleed.
A healthy systolic blood pressure is above 90. At just over 50, this patient has fallen dangerously low, and his condition is critical.
Yeah, Roger, no worries. Our ETA is approximately 8 minutes.
So we're going to somebody with abnormal physiology, so their blood pressure's low, and they've got some other symptoms that suggest maybe they've got a leaking large blood vessel. So really what they need is to get to hospital and a surgeon as quickly as possible.
Dr. David suspects the patient may have a ruptured aorta, the largest blood vessel in the body, which leads straight from the heart. It's a life-threatening emergency.
This is interesting.
This will be very interesting.
To complicate matters, the man lives on a narrowboat.
6-2 on scene. Should we take red bag for now?
Yeah.
And I can come back for anything that we need.
Do you know where we're actually going?
It's going to be down there, isn't it, I think?
Down there, isn't it? It's pretty slippy here.
It is slippy, just be careful. Can you see ambulance kit or anything?
Not yet. I mean, there's a light on in the boat, but quite a way round.
Okay, go ahead.
Thank you. We've parked nearby the ambulances and we've gone onto the canal front and we've turned right and are walking along the embankment. Can we just check that that's the right direction?
From the car park, it's a right turn at the end along the canal park.
Okay.
Yeah, it's here.
Hiya.
All right, hiya.
We found you, you all right?
Yes, you got us. All right, just in
We on there?
I'll let you go first. There's 3 already in there.
Okay, let me just step on a second.
Inside the boat, paramedics are treating 62-year-old retired decorator Gary, who is still on the floor where he collapsed.
How's that pain? Any better, any worse? A little worse, okay.
As well as feeling weak and dizzy, Gary's been suffering intense pain in his stomach.
And how's he doing observations-wise?
Systolic subordinate from 10.
Awesome, okay. Did you get that, Dave?
Yeah.
Yeah.
Okay, and how much fluid has he had? Okay.
Gary's blood pressure has responded well to being given intravenous fluids.
Just recap what happened today.
Dr. David hopes Gary's partner Emma will be able to shed more light on what's been going on.
I went to sick on Tuesday and he was just been sick all day. Yesterday he had severe stomach cramps and he was in a lot of pain. And he's just been dizzy, near fainting, he kept going to the toilet, so I had to carry him back to the bed. Because he's been literally passing out.
It's the middle of the week in the West Midlands.
Right, what else is to go on?
And critical care paramedic Jack Lewis and Dr. Jake Turner are getting ready for the night shift.
I've got 2 Tyvek, I think, in here. Have you got any in your... Oh no, I've got down to 1.
With the kind of incidents they're likely to encounter, preparation is crucial.
We've only got an extra large BP cuff. Where do we keep the others?
They are in store, so grab some.
Do we not carry a spare battery in there as well?
We should do, yes.
It's on the news recently, there's been a lot of stabbings around Birmingham. Some of them quite high-profile cases, so we're half expecting some retaliation assaults tonight, potentially. And it tends to be the gang-related assaults that happens with. There might be a stabbing early on in the evening, and then there'll be another one later on in the evening. But also, it can happen a few days later as well. Hopefully it doesn't happen, obviously, but if it does, then we'll be there to help however we can.
Ambulance service. Oh, hi, Approach Police here. Can we get your attention to a stabbing, please? Oh, dear. Breathing and awake? We do believe so, we're not quite sure.
Do we know if it's a male or a female?
I believe it's a female. A female has been attacked by some of the females. She's been stabbed with a machete.
Oh dear.
There's also been mention of a firearm as well. Apparently we've heard 2 gunshots. We've got 12 units en route at the moment with firearms as well.
Nine 8, go ahead.
9, channel 8, please.
Channel 8 received over.
With reports of a violent attack in a suburban street, Dr. Jake and Jack are dispatched.
So we've been tasked to a patient who's been attacked by a machete. Quite nasty injuries. Machetes, they're a combination of blunt force and sharp instrument trauma. It can cause quite severe injuries, significant blood loss.
While Jack and Dr. Jake are still a few minutes away, the first paramedics arrive at the scene.
Thank you. Yes, all involved parties have fled the scene. Police are doing an area search. Reporting 2 patients with machete injuries. The police are trying to urgently locate. As such, myself and the crew will continue to stand by for a few minutes pending updates from police officers.
Until the area is secured by armed police, all medical teams will have to remain at a safe distance.
Whiskey Romeo from 98. Can you just confirm the RVP, please?
Yeah, it looks like the Justice of Cockfield Avenue, Toll End Road, over.
Roger, thank you, that's all received.
A rendezvous point is assigned just down the road from the alleged attack. For now, the team must wait in their vehicles.
So, the offenders are unaccounted for. No idea on exact number of casualties or locations. So, if they've made it to run away and we still haven't found them, on balance, hopefully they're all right, with some fairly nasty wounds, but nothing that can't be cleaned up. Hopefully it's not the case that they've been stabbed through the chest, they've run down a dark alley and gone into cardiac arrest.
Hello, both. Right.
Hello.
Hello.
An operational commander arrives to give the team an update.
So we're currently here on Cookfields Avenue, Junction Road. So that car over there, there's a small amount of blood in the front of the car and the footwell and that. Obviously believed that there's been machete attack. We've also got another RTC slightly up the road here, and that's where they're saying there's a patient with slightly reduced GCS. And then we've got the other one, minor sort of slash wound to the leg, and that's slightly in that direction. So potentially they're all sort of 3 of them are linked.
It now appears that the incident is more complex than first thought.
So this looks like it's potentially one of 3 connected incidents across the general area here. We've got what looks like an assault involving individuals who may have been assaulted with machetes. Close by we've got a road traffic collision which has a vehicle that sounds like it might potentially have been involved in this incident, and we've got the ambulance there dealing with that. We've also got another stabbing not too far away that's turned out to be a knee laceration wound, so not requiring of our services, but again may well be connected. Currently the police are doing area searches, armed response officers are waiting to go into a couple of properties. So we're holding here for now to see whether the injured parties from this scene turn up.
I think this might lift up a bit.
In Wolverhampton, Dr. David and Kerry are helping to get a critically ill patient safely out of a canal boat.
Yeah, sorry, this cushion's not movable. It's all Velcroed on.
62-year-old Gary collapsed earlier with a suspected rupture to his aorta, the largest blood vessel in the body. It's a life-threatening condition which requires surgery.
If we've got the scoop to hand and if someone can slide it underneath us, that's going to be the best bet, isn't it?
Yeah, do you want me to chuck it on?
So far, Gary's responded well to intravenous fluids, and after plummeting earlier, his blood pressure has recovered, but he needs to go to hospital.
Right, we're just going to scoop it under.
Due to the challenging location, the ambulance service's hazardous area response team, or HART, has also arrived to assist.
Okay, a little bit push forward if you can. Going out, going in. We got enough to swivel yet?
If Gary's aorta is ruptured, any sudden movement could trigger a catastrophic internal bleed.
Okay, on your call.
Ready, steady, lift.
Okay, so we'll just put the hand on the stretcher so we don't move.
We have got... No.
Now slide across.
There you go. Sit. Right. Hello, young man.
Is that warmer? You okay?
Yeah.
The path back to the ambulance is dark, narrow, and treacherous.
It's pretty darn slippy up here, isn't it? Yeah.
No bumps coming up, brother. And again.
Yeah, it's a good job Harter here with their fancy stretcher.
Right now, buddy.
Good man, We're nearly out, okay?
Lower when you head in place. Head in place, Chris. Okay, and lower.
So, what I'm thinking, pop the monitoring back on, we'll get a set of obs. I'll just have a look at him, and then we'll make a decision about where to go from there, really.
Now in the ambulance, Dr. David is finally able to make a proper examination of the patient.
So, Gary, your partner is telling me that you've been unwell for a few days. Is that right?
Yeah.
And you've had the squits and a bit of vomiting?
Yeah.
Okay, and you've got some kind of tummy pain that's all the time, or just occasionally?
All the time.
All the time. Just gonna have a little look at your tummy. Is that painful?
Yeah.
Does the pain go through to your back at all?
Yeah.
Okay. And is it the same?
Although Gary's pain is consistent with a damaged aorta, his illness over the previous 3 days is not.
Bit of cold jelly coming on your tummy.
David uses an ultrasound to see if he can find out more.
Strangle all muscles.
Has he had any ondansetron at all? I think it's worth it if you're still feeling sick, just for the journey as well.
I can't see anything either way, so I can't see a large dilated aorta, but I can't see a normal size aorta, so I think it's a bit inconclusive, really. I'm just going to have a little feel of your pulse in your groin, OK? He's got a femoral pulse. Do you feel short of breath, Gary?
Yeah. He said originally he felt like he wasn't getting any oxygen.
I think he's hyperperfused, definitely.
Yeah.
He's cold, clammy, hypertensive.
He's cold as
got
well,
no
isn't he?
radial pulse, so I think he's very dehydrated from what's been going on.
Yeah.
At this stage, not enough can be deduced from Gary's symptoms to reach a diagnosis.
Fine, we'll go to. As we can't exclude with the ultrasound that there's a aortic problem going on, but I think it's unlikely from the history. I think it's probably worth going to Russell's Hall as opposed to New Cross, if that's all right, even though it's a bit further, in case they need to do anything vascular.
As a ruptured or swollen aorta can't be ruled out, Gary will need to go to a hospital that can provide the specialist surgery he may need.
In terms of treatment, I think we'll probably give him a bit more fluid.
Okay.
So you've given him 500 so far, yeah?
Yeah, so he's had 500 plus 100 of paracetamol.
Okay, yeah, I'd give him another 250. Well, I think once you've got a radial pulse, then I'd stop. And I don't think there's much else to do, really. But you're giving him some paracetamol, you're going to give him some ondansetron. You guys happy then?
Yeah, happy, thank you.
Gary, we're going to leave you in the capable hands of these guys, OK? They're going to take you to Russell's Hall.
With Gary's blood pressure now stable, Dr. David and Kerry don't need to travel with him.
David's speaking directly to the hospital, so they'll be expecting him when he gets there. And as he told you, we're just going to take him there as a precaution in case it is something vascular. All right. Yeah, he is. And his blood pressure's come up with fluids and stuff, which is good, so... All right. All the best. All right.
Thank you.
Once in hospital, further investigations will be made to uncover the cause of Gary's illness.
The initial history was pointing towards possibly the rupture of the abdominal aorta, which is a very serious and life-threatening issue, particularly if you have to move the patient extensively. So that was what we were considerably worried about. We've facilitated transfer of the patient to Russell's Hall, where there's availability of vascular surgery, depending on exactly what they find.
My recovery's going great. Still got to remember that I'm still healing inside, even though I'm not feeling pain all the time. And I would say I'm 99% there now.